If I'm frustrated before the night even begins, that's going to make sleep more difficult to attain. If I have racing thoughts at night because of either my sleep or something else that's producing anxiety, that's also going to get in the way of sleep from unfolding naturally. So we're working really from almost a holistic perspective.
Welcome to Worthy Mother Podcast. I'm your host, Emily Hardy, a mom of two on a mission to help moms everywhere feel less alone. This is not a parenting podcast. Instead, it's a space for pushing back against societal expectations of perfection and embracing self-compassion in your motherhood journey. Let's get into it.
Sleep is such a crucial part of our well-being, but as moms, it can often feel hard to come by. Of course, we know in the newborn phase, we're usually operating on very little sleep for obvious reasons, but the reality is that for many of us, the sleep problems continue long beyond that stage. So many moms are trying to get by in the survival mode that often comes with sleep deprivation. And I want to talk about how we can stop that damaging cycle from happening. So today I have Dr. Daniella Marchetti. She is a clinical psychologist with a board certification in behavioral sleep medicine, and she treats children, adults, and families with a variety of sleep concerns. So she is kind of the expert on all things sleep, particularly when it comes to talking to moms about sleep. So Dr. Marchetti, welcome to the podcast.
Thank you for having me.
Yeah. Can you share a little bit about your background and what drew you to specializing in behavioral sleep medicine?
Sure. So I identify as a health psychologist, which means that I did my doctorate specifically in health psychology at the University of Miami. Before that, I also had 2 master's degrees in clinical psychology. And so as a health psychologist, I treat a lot of concerns that are at that intersection of mental and physical health, things like, chronic pain, adjustment to diagnosis, etc. But when I started treating folks for insomnia, I was really pulled in because I realized that as far as health behaviors go, sleep is one of the ones that we have the least amount of control over. When it comes to diet and physical activity, we have a little bit more say, in when and what we do. But sleep, we can't just flip a switch. We can only, set the stage and promote good sleep, but it has to unfold naturally on its own. So for me, that was always really interesting, and that's why I devoted a lot of time in getting a specialty in behavioral sleep medicine.
So interesting to think about the way in which we don't really there's some things we do have control over with sleep. And I think some sleep problems are
Mhm.
perpetuated by decisions we make. And we will get into all of that. But I never really thought of it that way of it's something that is the impacts of it are like some things in our life where we do have more control, except for if you're dealing with insomnia, if you can't go to sleep, you can't go to sleep.
Right.
It's really, there's impacts to that. I'm curious, with that idea of health psychology and thinking about that intersection, what are you kind of dealing with when you're dealing with sleep from a psychological perspective?
Yeah. So we're dealing with behaviors as well as the way that we think and feel about our sleep. So yes, there are behavioral things that we're doing and engaging in, right? So our time in bed window, what kind of lifestyle are we living? What are we eating or consuming before bed? There are those behavioral pieces that we can work with. But then there's also how we're thinking and feeling about our sleep. And believe it or not, that adds an extra layer. If I'm frustrated before the night even begins, that's going to make sleep more difficult to attain. If I have racing thoughts at night because of either my sleep or something else that's producing anxiety, that's also going to get in the way of sleep from unfolding naturally. So we're working really from almost a holistic perspective. We're looking at, what we're doing, thinking and feeling, and how that all comes together to paint our sleep presentation.
I'm thinking about nights I've had where I wake up and I have to get up early, and you wake up at 3 in the morning and then you can't go back to sleep because of the panic of, if I don't fall back to sleep, I'm not going to get enough sleep for this thing that I have to do. And I feel like that is
Mhm.
very representative of kind of
Sure.
the different pieces that you're talking about there, where it's it may be something that's keeping you up, but the mental component of it
Yeah.
contributes.
Yeah, it can be hard not to get in our head about sleep.
Totally. Especially because it does have such a massive impact in our life. We have to have sleep. What are some of the most common sleep issues that you see in moms in particular?
So, in moms, I'll say this: insomnia is twice as likely to occur in women as it is in men. So I do see a
Oh,
lot
wow.
of yeah, I do see a lot of insomnia. The same goes for anxiety, by the way. It's 2 times more likely to occur in women, and these things are comorbid, which means they kind of come together often. Women are also twice as likely to have more restless leg syndrome. And, in moms, just especially depending on where they are in their journey, are they new moms? Are they postpartum? Are they, years into motherhood? There are so many different issues that can come up hormonally, biologically, and just socially too, with the demands that, mothers face on a day-to-day basis, whether they're managing, pickups and lunches or homeschooling or going to work. Moms just tend to have very little bandwidth for themselves at the end of the day, and that can impact their ability to sleep at night. And so one of those things that can happen when you feel like you have little bandwidth, actually, is something that we call bedtime procrastination or revenge bedtime procrastination. I also like to call it mom-somnia, where,
Mhm.
at night, let's say your kiddos are asleep and you have a couple hours to yourself, and then all of a sudden, your bedtime just keeps getting pushed back. One night you just go a little bit later than usual, and then that pattern persists over time. And it's tough because, again, when you have little bandwidth, that time that you have to yourself, you want to hold on to it. You want to savor it. You want to do all the things or none of the things and just, be on your phone, like doom scrolling. And that can, of course, impact, sleep onset and also sleep quality later on.
I'm like, yep. Revenge bedtime is very near and dear to my heart because it is something that I find myself doing far too often, and it's one of those things that, like, I know is not actually beneficial to me. Like, it's like, "Oh, I get the extra time and great, like, I've been working all day or I've been with the kids all day, and I get that extra time," and it feels in the moment like, "Oh, this is beneficial." Maybe sometimes it is,
Hmm.
but, like, I know it's not. I know not getting enough sleep because I stayed up too late is not beneficial, and yet I find myself in that pattern
Yeah,
often.
it's one of those questions of, short-term gain versus long-term pain, right? In the moment, it can feel really good, and it can almost feel like it's filling your cup to do whatever it is that you're doing at those hours of night, whether it's watching a show or reading or even just doing laundry. But over time, it can really add up to some negative consequences, right? So if we're consistently shorting our sleep because we're not getting to bed, that can impact our brain fog, our ability to concentrate and pay attention during the day, the energy that we have, not only to exercise and do our work, but to be with our kids. It can show up in our health too over time. We have a higher risk of chronic illness later on if we have chronic insufficient sleep or even insomnia.
Yeah, and we know that too. We know. I think that's such a interesting piece of it is like we know from an early age, like you're supposed to get a certain amount of sleep. We are told this isn't something that is just like ignored by society completely. And yet, again, I guess it's like the pieces where there are the behavioral things, but there's also the pieces that we have. I don't want to say no control over because we're going to get into
Hmm.
like how you support people in helping these sleep problems that kind of feel more out of the control. But it's like just knowing that you need the sleep doesn't actually necessarily get it to where, like, that's something you can develop the habit on your own with, because it's like there's so many other factors to it. How do you support people, moms, with sleep? I know you're certified in cognitive behavioral therapy for insomnia. What is that? How does that work for moms?
Yeah.
What are you
So
doing?
So, cognitive behavioral therapy for insomnia is the first line treatment for insomnia. So, even above sleeping medications. I always like to say that
Mhm.
CBTI, which is the acronym, has a really poor marketing issue because everyone knows about like Xanax and Ambien and Trazodone and those kinds of things. But not a lot of folks know about this therapy for insomnia. And so the way that it works is that it's a multi-component treatment, and we focus on your behaviors, how you think and feel about your sleep, and we monitor your sleep from week to adjust your time in bed window, to troubleshoot barriers that come up, to work on the cognitive pieces. Like if we know that sleep is good for us, but we're not going to bed on time, what are some of the thoughts that are coming up? Do we need to reframe the way that we look at sleep? Are there racing thoughts? Are there unhelpful thoughts or other patterns that contribute to sleep issues? And so this treatment is actually short term too. So for mothers who have very busy schedules, they actually don't need to devote that much time to it. When you're in therapy for other concerns like anxiety or depression, you can be in therapy for weeks, months, years. But this treatment, is really effective just in 6 to 8 sessions, which in the therapy world is like the blink of an eye. And so that means a lot in mother currency when you can, fix a problem related to your sleep in about, a month and a half to 2 months. And of course, you meet weekly in order to see those benefits.
There's a piece of it that I'm wondering if this is part of it, is like the accountability almost for like if you're, quote, supposed to be going to bed at a certain time and you're not. Do you see that being like when you're working with somebody on those pieces of like, okay, we're going to try and adjust the sleep window? Is that accountability piece
Of
a large
course.
part of it?
Yeah. So, everything that gets done in CBTI is always done in collaboration with the patient, right? So, if
Right.
someone comes to me and they say they want to sleep better and we're trying to pick an optimal time in bed window, that's always done, in communication with them. Like, how realistic is it for us to get into bed at this time, to get out of bed at this time? And if over the weeks, because we are monitoring with sleep logs, if we see that a certain pattern just isn't working, then we regroup, we adjust our sails, and we figure out where to go from there. So there is accountability. And because you come to weekly sessions, I think that also helps because that on day 7, you're going to see me and we're going to talk about it. And we might have to answer for some of our crimes. Right. So it does help because, you're also working towards a goal and you're seeing someone on a weekly basis. But what I do see often isn't even an issue with the time in bed window. It's that once you get into bed, it's like, okay, I can physically put myself there, but I can't just shut my mind off, or
Yeah.
I can't just snap my fingers and fall asleep. And that's the insomnia of it all, right? So a big piece of CBTI is actually relearning the association between our bed and sleepiness. If you've had trouble with insomnia for a long time, somewhere along the way, we might have weakened that association. If we're spending a lot of time in bed awake, a lot of time in bed tossing and turning or worrying, that bed might become that space where now our brain thinks, oh, here, this is where we go for fun, this is where we go for work. And we really want is for our brain to have that automaticity of, I get to bed, I go to sleep. And so a big part of CBTI is helping the patient relearn that association. And, what strategies do we have, to again, just like strengthen that relationship between the bed and sleepiness?
Yeah. That's interesting. I've never like thought of that, but it makes so much sense. Like if you're spending hours scrolling TikTok in bed before you go to sleep, like the act of laying down in bed isn't like, okay, now it's time to shut my brain off and go to sleep. Like that's so interesting, just how rewiring that actual association is such a big part of it. Like it makes sense.
Yeah, CBTI is, it's evidence-based, the research supports it, and it all stems from these principles that maybe you've even learned about in your own study or in different areas, like a classical conditioning and behaviorism. There is a rhyme and reason to it. And relearning that association is really the heart and soul of CBTI and what separates it from just doing sleep hygiene.
I'm curious because obviously there's like the personal self-related factors, whether it's, engaging in behaviors that are not that are affecting the sleep window or the like actually having the trouble going to sleep, staying asleep, all of that. But there's also the factor of our kids,
Mm,
right? Like I
yeah.
think that's like we have to talk about it because I'm just thinking of like periods of time in my life where like even just getting to bed, it was like my sleep window couldn't be great because it took hours to get the kids to sleep. Like I was going to be
Hmm.
going to sleep late. And if I wanted to get anything done after they were asleep, or if the kids are waking up and if they're dealing with nightmares or like my kid gets growing pains, there's just like different things that factor into our sleep that may not actually be related to us. It's our children. Does CBTI help with any of that, or is that something that you have to approach differently, maybe even working with the child?
Yeah, so, those kinds of external causes of wake ups, those can be addressed in CBTI. However, this is why I always say it's great to work with a sleep specialist. So, someone that has dedicated extra time. Because there are some folks out there that can do CBTI, but they may not necessarily have a board certification. And if you have a board certification, what that means is you're fluent in a variety of sleep disorders as well as different populations, like being able to work with kids as well as adults. So if you were to, get a CBTI specialist that doesn't work with children, then some of these questions you're bringing up may be more challenging to address in treatment. But certainly, when in the cases that I've seen it, I do a much more transdiagnostic approach to CBTI, which means, I also do a little psychoeducation on sleep training. So if I have parents that are being woken up by night terrors, what can we do about that? Let's talk about, what we can do to protect our sleep. If I have a newborn that needs to be fed several times a night, what can we do to reduce harm, from waking up so many times and set the stage so that I don't develop insomnia later on? So these features, again, can be addressed by someone who has experience, with kids and families. And there are certainly pieces that can help the whole family. I always say, 25% of children have sleep issues, which means at least 25% of parents do. So you can't treat these things in a vacuum. You're working with a whole family ecosystem when you have a patient that has kids.
Yeah. You said something there about with like feeding the baby and like working on not developing the insomnia later. And I think that's an interesting thought is like how sleep issues with the kids can contribute to like more individualized sleep issues. So like if you're being woken up a lot, like is it harder to fall back asleep? Like if you can fall asleep the first time you lay your head down on the pillow, but you have to wake up 3 times in the middle of the night, that's like 3 different opportunities for that to be challenging. And
Right.
I imagine with associations of like there's just a lot that can happen there. It's so complex.
Yeah, yeah. And I'll say that that's a presentation I get often from mothers. It's the comment is always, "All right, my kid is sleeping through the night now, but I can't sleep through the night now. So now I have the opportunity to sleep, but I can't." And a part of that is because if you were waking up frequently, to take care of your child, or if you're a caregiver for anyone, really, you are sleeping really with one eye open. And so what that means is it's harder for you to get into those deeper stages of sleep. So it just feels less restorative. And then you have almost this like jumpy quality to your sleep where you're on edge. And so if you get into that pattern over time of just being on edge when you sleep, then that can create a hotbed of issues later on.
Is there like further treatment? Like, is there times, I imagine there's times where CBTI doesn't work depending on like the root cause of the sleep issues, because I know, like you said, there's like hormonal issues that can come up and more like, I guess, like physical health based things. Where's kind of the boundary of where CBTI works? Or is that kind of more of a loose boundary? Really depends on the issues.
Yeah, so the research has shown that as many as 70 to 80% of people with primary insomnia experience improvements in their symptoms after a course of treatment. And just to give you some context, that's a huge number. When it comes to
Yeah.
therapies, the effect sizes when people have done research to look at how replicable findings are, to see how effective certain treatment protocols are. The effect sizes of CBTI are virtually unmatched by other modalities. So there's a lot that CBTI can cover. But you're right, it's not, sometimes it's not a silver bullet. There may be other things, especially if you're medically complex or if there's another reason for your insomnia. So it's always important when you meet with a specialist, when they conduct that initial intake, that screening, that they ask you about your medical history, about any medications that you're taking, about a detailed history of the onset of your sleep problems to identify, okay, maybe this person needs a sleep study. Maybe they have another sleep disorder that needs to be treated before we can tackle the insomnia. It is very nuanced. Every person is a universe, and you want to take into account all of these factors. And so for that reason, my intakes are usually 90 minutes long because I want to be thorough. So yes, if there is like a medical reason for insomnia, then we want to, work with those other providers too. Is this a side effect of a medication, of a treatment? I see this a lot, in psycho-oncology patients, where there's no way around their oncological treatment, but, there are very clear side effects. And so we come from like a harm reduction perspective in those cases. So yes, it is very complex. It's not a silver bullet, but it does have very large effect sizes when it comes to how effective it is.
Yeah, when you said that number, the percentage of patients that it tends to be effective for in improving sleep outcomes, like I just feel like this sigh of relief for moms in general. Like it's like this is something I think that feels so impossible to tackle so often, or like it feels like something you have to do, I don't know, some crazy intervention to be able to like sleep because it's like it's not working, you know. I think people try do a lot of like self-research and try things and it's like it doesn't work. And I think we can get stuck in those cycles of being in survival mode because we're not getting enough sleep. So many moms feel like that. So many moms feel completely sleep deprived. And it's like, what do I do about it? Like, I don't know. And I think just hearing that, oh, there are ways that are not very intrusive, right? Like this type of therapy, it is like so holistic. It's tackling a bunch of different things, but it's also like doable. And it sounds like something that can work fairly quickly with the right approach and the right like lens of we're looking at the whole issue. We're looking at all the different factors here.
Yeah, and and again, like not a lot of moms know about it. Not even a lot of
Yeah,
folks in my profession know about it. And so we need to do something about that PR issue. Because
totally.
in the United States, there are about 200 of us that even have this board certification. So it is a very small niche, but the people that care about sleep really care about sleep. So, I know that feeling all too well because when I discovered CBTI and I saw how effective it was, that was around the time when I became a mother. And so I know all too well how important sleep is and how desperate it can feel when
Yeah.
you're going to bed and you need to rest, and for whatever reason, it's just not on the table. It can make you feel helpless. So for that reason, I advocate for CBTI and just spreading a little sleep knowledge whenever I can.
Yeah. I'm wondering for moms who feel like good sleep is impossible right now for whatever reason that we've kind of discussed, where can they realistically start? Is starting with a sleep psychologist kind of right away if you've been dealing with chronic sleep issues a good idea because it is so effective, or are there other things that you would recommend trying first?
Sure. So sleep issues are very common. Okay. And so it's possible that you have a bout of poor sleep and then it goes back to normal, right? So I would say if you've been spending 2 weeks in earnest trying to change your sleep with sleep hygiene things, so like things that you've probably read online, like limit your caffeine, make sure it's a dark and quiet room, etc. If you've done that for about 2 weeks and you haven't found any benefit, then I would start looking for a sleep specialist because there can be long wait times. If it's been a month and you haven't had good sleep, let's say 3 nights out of the week consistently, at that point, I would say make an appointment because at that point, it's acute insomnia. And if you're past 3 months of poor sleep, make an appointment yesterday because at 3 months, we consider that chronic insomnia. And, it's more difficult, to treat things the longer that we've had them, especially when we're working with associations and relationships, right? So, yeah, so 2 weeks, if you've tried things on your own, I would look for a sleep specialist. After 1 month, then I would definitely make an appointment. Because you know what? If you meet with a sleep specialist, they're going to help you identify exactly what's maintaining the insomnia, what's keeping it going. And that's important.
Going back to the like impacts on mental health and health that there can be when we're not getting enough sleep, it's almost like it's such a good reason to tackle it early. Like when you start having the problem before you start developing other problems because of the lack of sleep, because we know that that can happen. If you're not getting enough sleep, it's hard to like maintain good mental health and it's hard to maintain good physical health because of a lot of different reasons. So that makes sense. And I just love how approachable it is when you think about how effective this type of therapy is. It's like it's worth diving in and going for it if it's a real problem.
Yeah, absolutely.
I'm curious if you have any tips to leave moms with who may like deal with racing thoughts in the middle of the night or have issues going to sleep. Are there any like little action steps to take that may be worth trying?
Yes. I always say it's really important to make an appointment with your anxiety before your anxiety makes an appointment with you.
Mm.
Because
Mm.
oftentimes, yeah, if we don't make time or create space for some of these things that may be making us feel more tense or stressed or anxious, then usually it's when you least expect it, it'll pop up, right? So on the drive home, or when you're just putting your head to your pillow and your mind starts to quiet, or even in the middle of the night, you might wake up and it's 3 a.m. and you don't know why you're awake. You just know that you're awake. And that's anxiety. That's what we call conditioned hyperarousal. And so if we can create space for some of our stressors, during the day, then it almost feels like we're meeting that need before bedtime rolls around. And so, I might recommend like a dedicated worry time. If you see another mental health provider, making sure you follow up with those appointments. But let's say prevention is off the table and it's already nighttime and the racing thoughts are here. Then the number one thing that I would say is actually, get out of bed. We don't want to associate worry or stress with the bed. So if you have these racing thoughts, get out of bed, do something monotonous, something non-stimulating, something that will help make you sleepy, and something that will ultimately distract you so that you can get unstuck from those racing thoughts. And then come back to bed once you feel sleepy again. So that way you're, again, limiting your time in bed to when you're actually asleep. You get to strengthen that association of your bed with sleepiness. You distract yourself so that you don't get frustrated because you have racing thoughts and you can't fall asleep. And during that time, you could even do like a relaxation exercise, a deep breathing exercise, progressive muscle relaxation, guided imagery. You can do these other things to help quiet some of those thoughts, or even a cognitive shuffling exercise is a lot of fun. Cognitive shuffling is like a way to, again, get unstuck from some of the thoughts that you're having. And it mimics what the brain does when it tries to fall asleep by shuffling in between some neutral, random thoughts instead of what might be like an emotionally charged thought that has rhyme or reason to it. The name of the game is that we want to make sure that our thoughts are neutral and also nonlinear, right? So when we're falling asleep, the mind actually doesn't totally quiet. It shuffles from one thought to another. It's not total silence. But sometimes when we're shuffling between thoughts, we might hit a chord. We might think of something that gets us stuck, and then now we're awake and we're alert, and maybe we're catastrophizing about something. But with cognitive shuffling, let's say I pick a random word, like let's say the word apple, and then I play a little word association. Okay, so like A is for alligator, P is for python, P is for plate, L is for lemon, E is for elephant. Now I am shuffling through my thoughts, but, the words don't mean anything that's emotionally charged to me. They're a little bit more random and neutral. And if I can continue to do this and just try to like shuffle and play a little word association, eventually I'll fall asleep. And I keep myself from drifting back to whatever the sticky thought was.
Yeah. It's like holding the attention somewhere, but like not somewhere that's holding your attention too much where the sleep isn't taking over. But that makes sense. And I mean, as somebody who will wake up at 3 a.m. sometimes with anxieties where I'm like, why did I just think of this now? I love the like thought of making an appointment with those things before you go to bed, because it's like, if I can just get it out and deal with, like, I know that I need to deal with this. It's written down somewhere that I'm not thinking at 3 a.m. about something where I'm like, oh, but if I don't deal with it now, but I'm not going to deal with it now. It's 3 a.m. and then I'm just like stuck on it. That makes so much sense. And then, that kind of idea of like keeping your mind on something else that is allowing you to like calm down. I think I've learned so much in this conversation
Good.
that I'm
So
like,
good.
okay, there's little things that I can take when I am like, okay, let's not do revenge bedtime tonight. Let's actually like try to go to sleep at a decent time so we feel good in the morning. And I think that with a lot of just what's going on in our world right now, I feel like other people can probably relate to what I've experienced, where like I've had sleep problems in the past with anxiety. That's not as much something I'm dealing with right now, but that revenge bedtime piece, it's like it has to do with my kids, but it also has to do with like how overwhelming the world is and how overwhelming my schedule is. And it's something that I need to work on. And I think there's some things in here that I can take and start working on tonight. And I hope for anyone listening, they can as well. And also like knowing that if these are things that are kind of beyond what you're able to tackle on your own, that there's like legit support out there that can make a huge impact quickly. And I just think that's really powerful and takes away a lot of that helplessness that can come with feeling like we're stuck in cycles of horrible sleep and feeling completely drained in our life.
Mm-hmm.
So something that I love wrapping up the conversation with is just a more general question on caring for ourselves as moms. I think it's important to talk about the need to care for ourselves and our well-beings as moms in a world that is like pushing us to care for everybody else. How do you take care of yourself? And do you have any tips for moms to make sure they're taking care of themselves regularly?
Yes. Well, I do exercise several times a week. I jump on my Peloton pretty regularly. But the things that I've been doing recently to take care of myself are a little bit different. I've started going to the sauna in the evenings close to my house. And that's something that does help with sleep, actually. So engaging in some like heat in the last 3 hours of your day can help facilitate sleep onset because of the body temperature changes that need to happen with sleep. But the other things that I do to take care of myself and fill my cup are just, incorporating fun like back into my schedule, as we go through life and, the responsibilities of work and family, pile on. Fun activities are usually the first thing to fall by the wayside in the service of the things we have to do. But fun isn't just the work of children. It's something that we all need to be intentional about. And for me, that looks like creative writing. So yeah, just trying to incorporate some fun into my days has been how I take care of myself.
I love that. And I love that that is like the thing that is bringing you joy and fun. Creative writing, like being creative, expressing yourself.
Mhm.
What a fun thing to tap into. And
Yeah,
I completely
even if
agree.
nobody ever reads it, it's just fun for me
Totally.
to go somewhere else. It's a little escapism.
Yes, which we all need when there's so much going on in our lives. We need a little outlet to escape. And I think that's really cool. It's a cool hobby. Where can listeners find you and what should they be looking out for? How can they work with you also, if that is something that's available to them? Like, where do people have to be to work with you?
Great. Yeah, well, if anyone wants to work with me, either as a patient or, if you want an educational seminar or something like that, you can look at my website, which is daniellamarchetti.com. You can schedule a free consultation on there. I love offering that because it gives folks a minute to meet you and see if it'd be a good fit, if they want to work with you. So you're welcome to sign up for, a free call and just get more information about what offerings I have. You can also find me on Instagram. My handle is at Dr. Daniella Marchetti. And I really just use that as a space to share some sleep tips and tricks. And, I like to try to make it as much as a community as possible. So if there's something that people want to know about, like sleep talking, sleepwalking, or insomnia or sleep apnea or anything like that, I love sharing, whatever I can and just to spread some sleep education out there.
Amazing. Well, if this conversation sparked you a little bit, maybe woke you up to, okay, maybe this is something I want to address, I definitely recommend that you give Dr. Daniella Marchetti a follow because there's some good stuff on there. And I think for the most part, we all could use better sleep.
No, yeah. Yeah, I won't fight you for good sleep.
It's important.
Right.
Well, thank you so much for being here and sharing your wealth of knowledge with us.
Oh, no, it's my pleasure. Thank you so much for having me. I hope that this could be helpful for someone.
And thank you for tuning in. You are worthy, Mama.